Vital signs. What are they exactly and why are they, well, vital? There are 4 basic vital signs. You got temperature, heart rate, respiration rate, and blood pressure. These are called vital signs because they indicate the status of the vital functions of the body. In other words, the life-sustaining functions of the body. So let's get into this. Temperature, as we all know, if you have a high temperature, that's a fever. That's not good. It can be a sign of infection. So temperature of 100.4 or higher, that's considered a fever. But this could be more than just a sign of infection. You can get a high temperature from various other things, obviously being exposed to high temperatures if you're overheated, but also things like blood clots in the lungs or other inflammatory conditions can cause a high fever or a high temperature. Not just infection, but infection is by far the most common cause of an elevated temperature. So that's why when we think of fever, usually we think of an infection either with a virus or bacteria. Low temperature or hypothermia is also a problem. This is, in my opinion, even more concerning because a low temperature can lead to cardiac arrest. It's one of the H's and T's that we memorize in medical school as causes of cardiac arrest. Low temperature is hypothermia. Next, we have heart rate. You can measure this by just checking your pulse, counting the number of beats per minute. So this is a marker of cardiac function. A heart rate that is too slow is called bradycardia. If it's really slow, it might be that the heart is pumping too slowly to effectively deliver blood to all the tissues in the body. We see this in heart block or conduction abnormalities in the heart that prevent it from pumping normally. A heart rate that is too fast is also a problem. We call this tachycardia. This can happen normally as a result of exercise. You get a heart rate well above 100, 130 beats per minute or even higher, but sometimes it can be pathologic. It can be a problem if you have an arrhythmia. The most common arrhythmia that I encounter is atrial fibrillation, which itself doesn't necessarily cause a fast heart rate, but sometimes you get rapid ventricular response, or the whole part of the heart just starts beating too fast as a result of this abnormal heart rhythm. So that's also a problem. So that's yet another reason why we want to keep track of heart rate. Next, we have respiration rate. So this one is a marker of respiratory function. If you're breathing too slowly, you might see this in drug overdose, like fentanyl overdose. This can be life-threatening for sure. People die from this every year. But also breathing too quickly is also a problem. That's a sign of respiratory distress. An example of this might be in asthma exacerbation, where you're just not able to effectively move air in and out of the lungs. To try to compensate, the body makes you breathe really quickly, fast breaths, which are a sign of respiratory distress. Next, on to blood pressure. So what's the big deal with this? So you've probably experienced this at the doctor's office. They put on the little puff machine that measures your blood pressure. Blood pressure itself is just a number, but it's a convenient number because it helps us as doctors estimate perfusion in the body. In a way, it's a surrogate that we can easily measure to monitor perfusion of blood in the body. Are the vital organs getting enough blood flow? So blood pressure is a way that we can measure this. If the blood pressure is too low, that's really a problem. We see this in shock. Shock, it can occur from a bad infection or bleeding, or a cardiovascular collapse, like with a heart attack. If the heart basically stops pumping effectively, you can end up with low blood pressure, which leads to shock. The tissues in the body don't get enough blood, and the organs can die as a result of that. Obviously, this can lead to a life-threatening situation. Now, a blood pressure that's too high, I think you see a common theme here. Too high and too low are always bad. So blood pressure that's too high, in the short term, it might not cause any problem, but over a long period of time, years and years, can cause damage to the organs. So high blood pressure, if it's not treated, can damage the kidneys. It can also cause a lot of strain on the heart. The heart muscle can become very thick and non-compliant as a result of this. And so high blood pressure, also something that you want to get under control. So there we go. Those are the 4 vital signs. Depending on where you work, there are also 5th and 6th vital signs that are not necessarily universally embraced as vital signs. But some examples of these would be pain. In the veterans hospitals, I think they consider pain to be the 5th vital sign. When medical staff measure the vital signs, they will also ask patients to rate their current level of pain based on the FACES pain scale is a common one. And just to clarify, the FACES pain scale, the way you do it is the patient looks at the scale and then uses it to describe how much pain they're currently experiencing. This is not for the clinician or the doctor to look at and try to see which face looks most closely resembles that of the patient. That's not how you use the pain scale. But anyway, pain is sometimes considered the 5th vital sign. Another additional vital sign is oxygen saturation. So this one, I mean, at first glance, maybe you think it's redundant because we're already looking at our respirations with the respiratory rate, already kind of looking at how well a patient is breathing, but the oxygen saturation adds even further information here. It looks at the oxygen concentration in the blood. Here, if it's too low, oftentimes we'll say less than 92%, then the body is just not getting enough oxygen. So this is pretty common. We saw this all the time in COVID-19. We call it hypoxemia or hypoxemic respiratory failure. So I think personally, I would consider the oxygen saturation to be a vital sign, something that we definitely want to measure when we're measuring the other vital signs. So there you go. There's a quick introduction into vital signs. And I'll be honest, I didn't really even know what these were or understand their significance until I was well into medical school. So even though this stuff seems pretty basic, I don't think it's common knowledge, especially for those who do not work in healthcare. And that's why I wanted to make this video. Anyways, that's it. Thanks for checking out the video. If you like medical content like this, feel free to hit the subscribe button there and check out another video here. And I'll see you guys next time.